What if something as ordinary as the ingredients already sitting in your kitchen could play a meaningful role in supporting your vascular health? I know that might sound too simple to be true, but stay with me, because the science behind what I'm about to share might genuinely surprise you. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, I hope you'll stay connected with this channel. We're here to help you understand your body with clarity, compassion, and evidence-based information. Today, I want to talk about something that comes up constantly in my practice: circulation, blood flow, and what you can actually do to support your vascular health naturally. And I'm going to address some popular claims you may have heard about olive oil and vinegar while giving you the complete picture based on what we actually know from medical research. Before we dive in, I want you to know something important. If you've been experiencing changes in your erectile function, your energy levels, or other signs that concern you, that matters. Your body is trying to tell you something, and paying attention to those signals is one of the smartest things you can do for your long-term health. Understanding what's really happening in your body. Let me start by talking about something fundamental that doesn't get discussed nearly enough: the connection between your overall vascular health and erectile function. When men come to my office worried about erections, they often feel embarrassed or defeated. They think it's just about aging, or they assume there's nothing they can do. But here's what I always explain. Erectile function is actually a window into your overall cardiovascular health. Think about it this way. The blood vessels in your penis are some of the smallest, most delicate arteries in your entire body. They're even smaller than the coronary arteries that feed your heart. So when blood flow becomes compromised anywhere in your vascular system, the penis is often where you'll notice problems first. This is why urologists sometimes say that erectile dysfunction can be the canary in the coal mine for cardiovascular disease. Research has shown that men who develop erectile difficulties are at increased risk for heart problems down the line. One study followed men with erectile dysfunction and found that within 7 years, a significant percentage went on to experience cardiovascular events. Now, I'm not sharing this to scare you. I'm sharing it because it's actually empowering information. If erectile function is a barometer of your vascular health, that means taking steps to improve your circulation can benefit your entire body, not just your sexual function. The science of blood flow and erections. Let me explain how erections actually work, because understanding the mechanism helps everything else make sense. An erection is what we call a vascular event. It's a hydraulic process that depends entirely on blood flow. When you become aroused, your nervous system sends signals that trigger the release of a molecule called nitric oxide in the lining of your blood vessels. Nitric oxide is absolutely crucial. It causes the smooth muscle cells in your arterial walls to relax, a process called vasodilation. When those blood vessels relax and widen, blood rushes into the erectile chambers of the penis, called the corpora cavernosa. At the same time, the veins that normally drain blood away get compressed, trapping the blood inside. That's what creates firmness. The entire process depends on having healthy, responsive blood vessels and adequate nitric oxide production. When either of those systems isn't working properly, erectile function suffers. Where olive oil fits into the picture. Now, you've probably heard a lot about the Mediterranean diet and its benefits for heart health, and it's true that populations who consume more olive oil, especially extra virgin olive oil, tend to have better cardiovascular outcomes. Olive oil contains monounsaturated fats and compounds called polyphenols that have genuine anti-inflammatory and antioxidant properties. These substances help protect the endothelium, which is that crucial inner lining of your blood vessels where nitric oxide gets produced. When you consume high-quality olive oil regularly as part of a balanced diet, you're supporting the infrastructure of your vascular system. You're reducing inflammation that can damage arterial walls, and you're providing antioxidants that protect against oxidative stress. But here's the important distinction. Olive oil supports vascular health over time. It's protective and beneficial for the long-term health of your circulatory system. However, it doesn't directly trigger the release of nitric oxide in the moment. It's not a direct vasodilator. Think of olive oil as maintaining the roads in good condition so traffic can flow smoothly, but it's not the signal that actually opens the gates and lets the traffic through. The vinegar question: what does the research actually say? So this brings us to vinegar, and specifically to some claims you may have encountered about combining vinegar with olive oil for circulation and erectile function. Vinegar, particularly apple cider vinegar and red wine vinegar, contains acetic acid. There has been research looking at how acetic acid affects various metabolic processes in the body. Some studies have suggested that consuming vinegar before meals may help moderate blood sugar spikes, which is relevant because chronic high blood sugar damages blood vessels over time. Other research has looked at vinegar's potential effects on inflammation and body composition. Now here's where we need to be very careful about claims. While there is preliminary research suggesting that acetic acid may influence nitric oxide pathways in some contexts, the evidence for vinegar directly improving erectile function or dramatically boosting circulation in humans is quite limited. What we do know is that anything that helps control blood sugar, reduce inflammation, and support metabolic health will indirectly benefit your vascular system. And your vascular system includes the blood vessels serving your penis. So, consuming vinegar as part of a healthy diet, particularly if it helps you manage blood sugar or reduce overall inflammation, could theoretically contribute to better circulation over time. But we need to be honest about the strength of the evidence and avoid making promises that aren't supported by robust clinical trials. What actually works? The evidence-based approach. Let me share with you what we know from good quality research actually does make a meaningful difference in circulation and erectile function. First and most important, your overall lifestyle. I know that's not a quick fix, and I know it's not what people always want to hear, but the data is absolutely clear that regular physical activity, maintaining a healthy weight, not smoking, limiting alcohol, getting adequate sleep, and managing stress all significantly impact erectile function. Aerobic exercise in particular has been shown in multiple studies to improve erectile function. Why? Because it directly strengthens your cardiovascular system, improves blood flow throughout your body, and helps maintain healthy blood pressure. Resistance training matters too, because it supports healthy testosterone levels, and testosterone plays an important role in sexual desire and function. Your diet overall makes a much bigger difference than any single ingredient. Eating plenty of vegetables, fruits, whole grains, lean proteins, and healthy fats while limiting processed foods, excess sugar, and excessive red meat has been associated with better erectile function in research studies. Specific nutrients that have shown promise in studies include foods rich in flavonoids like berries, citrus fruits, and dark chocolate in moderation. Foods that support nitric oxide production, including leafy greens high in nitrates, have also shown benefits. A practical approach to dietary support. So where does this leave us with olive oil and vinegar? If you enjoy making salads with olive oil and vinegar dressing, that's wonderful. It's a delicious way to increase your vegetable intake, and both ingredients have properties that support overall health. Having a simple vinegar and water drink before a meal, if it helps you manage blood sugar and you tolerate it well, could be part of a healthy routine. But I want to emphasize, this should be part of a comprehensive approach, not a magic solution on its own. Here's what I would actually recommend if you want to use these ingredients thoughtfully. Use extra virgin olive oil as your primary cooking and dressing oil. The darker, more flavorful varieties tend to have higher polyphenol content. Drizzle it on vegetables, use it in salad dressings, cook with it at moderate temperatures. If you want to incorporate vinegar, try mixing 1 to 2 teaspoons of apple cider vinegar or red wine vinegar in a glass of water about 10 to 15 minutes before your main meals. This may help moderate your blood sugar response to the meal. Build salads that combine both. Dark leafy greens, colorful vegetables, maybe some nuts or seeds, dressed with olive oil and vinegar. This gives you fiber, antioxidants, healthy fats, and helps you eat more plants overall. But please hear me clearly. These are supportive practices within a larger healthy lifestyle. They are not substitutes for the fundamentals of cardiovascular health. Critical safety information. Now I need to address something really important because I have seen patients make dangerous mistakes. Never, under any circumstances, apply vinegar directly to your penis. I cannot stress this enough. The tissue of the penis is incredibly delicate and sensitive. Vinegar is acidic enough to cause chemical burns, severe irritation, and lasting damage to this sensitive skin. I have treated men who came in with painful burns and blistering because they read something online suggesting topical application. Please don't do this. These interventions work through your bloodstream and your overall vascular health, not through topical application. Also, if you're taking certain medications, you need to be cautious. If you're on blood thinners, diabetes medications, or have acid reflux or stomach ulcers, talk to your doctor before significantly increasing your vinegar intake. Vinegar can interact with some medications and isn't appropriate for everyone. When to seek medical evaluation. Here's something else that's really important. While lifestyle and dietary changes can absolutely support your vascular health, sudden or progressive erectile dysfunction deserves medical evaluation. If you're experiencing persistent difficulties with erections, that's your body sending you a signal. It might be indicating early cardiovascular changes that need attention. It could reflect hormonal imbalances, medication side effects, or other treatable conditions. Please don't try to manage this entirely on your own with dietary interventions. Make an appointment with a urologist or your primary care physician. We can do a thorough evaluation, check your cardiovascular risk factors, assess your hormone levels, and discuss all your treatment options. Sometimes medication is appropriate, sometimes it's a matter of adjusting other medications you're taking. Sometimes we discover underlying conditions like sleep apnea or diabetes that were contributing to the problem. You deserve a complete evaluation and personalized care. The bigger picture, what really matters? I want to circle back to something fundamental. The questions I get about quick fixes, special supplements, or miracle foods often come from a place of real distress. Men feel frustrated, embarrassed, sometimes even desperate to restore function they've lost. I understand that completely. Sexual health is deeply tied to your sense of identity, your confidence, your intimate relationships. When things aren't working the way they used to, it affects you emotionally and psychologically, not just physically. But here's what I've learned from taking care of patients for many years. The men who do best are the ones who take a comprehensive approach. They're the ones who understand that their erectile health is connected to their overall health. They make changes to their diet not just to fix one problem, but because they want to feel energetic and strong. They exercise not just for erections, but because they want to be active and capable well into their later years. They manage stress because they recognize it affects everything from their sleep to their relationships to their physical health. When you approach it this way, you often find that as your overall health improves, multiple things get better together. Your energy increases, your mood improves, your sleep gets more restful, and yes, often your sexual function improves too. Real expectations and realistic timelines. If you do decide to make dietary changes, including incorporating more olive oil, vinegar, and other healthy foods, what should you expect? First, understand that these are gradual processes. You're not going to see overnight transformations. Vascular health improves over weeks and months, not hours and days. In the first couple weeks, you might notice better energy or more stable blood sugar, if that was an issue for you. You might sleep a bit better. These are signs that your body is responding positively to healthier inputs. Over the course of several weeks to months, if you're combining dietary improvements with other healthy lifestyle changes, you may start noticing improvements in erectile function. For some men, morning erections return. Firmness during intimacy improves. Confidence starts rebuilding. But again, this works best as part of a complete approach. Diet alone, no matter how optimized, can't overcome severe vascular disease, significant hormonal deficiencies, or other underlying medical issues. The role of stress and mental health. I also want to address something that often gets overlooked: the psychological component of erectile function. Stress, anxiety, and depression all significantly impact sexual function. When you're chronically stressed, your body is in fight or flight mode. That means blood flow is being directed to your muscles and brain for survival, not to your reproductive organs for intimacy. Performance anxiety creates a vicious cycle. You have trouble getting an erection once, maybe due to fatigue or stress or alcohol. Then the next time you're intimate, you're worried about it happening again. That anxiety itself makes it more likely to happen, which increases your worry, and the cycle continues. Being kind to yourself, managing stress through whatever healthy methods work for you, Whether that's exercise, meditation, therapy, or quality time with loved ones, matters enormously for sexual health. If you're experiencing significant anxiety around sexual performance, working with a therapist who specializes in sexual health can be incredibly valuable. There are evidence-based techniques that can help break that anxiety cycle. Closing thoughts: taking control of your health. Here's what I want you to take away from all of this. Your sexual health matters. Your concerns are valid, and there are real, evidence-based things you can do to support your circulation and overall vascular health. Olive oil and vinegar can be part of a healthy dietary pattern that supports your cardiovascular system. They're not magic bullets, but they're not worthless either. Used appropriately as part of a Mediterranean-style diet, rich in vegetables, fruits, whole grains, and lean proteins, they contribute to an eating pattern that's been shown to benefit heart and vascular health. But the most powerful tools you have are the comprehensive lifestyle choices you make every day. How you move your body, what you feed it, how you manage stress, whether you get adequate sleep. These are the foundations of lasting health. If you're experiencing erectile difficulties, please don't suffer in silence or try to fix it entirely on your own. Reach out to a healthcare provider who can give you a thorough evaluation and discuss all your options. There's no shame in seeking help for something that affects your quality of life and your relationships. Your body is telling you a story. The question is whether you're willing to listen and respond with the care and attention you deserve. Take care of your vascular health. Take care of your overall health. And know that small, consistent changes really do add up over time to meaningful improvements in how you feel and function. Thank you for watching, and as always, remember to take care of yourself because you're worth it.